Want to know how to be successful in your nursing lab course? When it comes to practicing and applying your nursing skills in lab, students often assume that lab courses are easier than regular theory or in-class courses. As a previous nursing lab instructor and nursing professor, I've got a few success tips and strategies that you might find helpful in lab and beyond. Stick around. Hi everyone, my name is Professor Jus B and this is LJ. Welcome to my channel. If you're new here, this channel was created to support nursing and healthcare students just like you. As a nursing professor and educator, I offer tips and expert advice that will help you succeed in school and in your new career. If this is something that you're interested in, show me some love and support. Hit that like button, leave a comment, and subscribe to my channel so you don't miss out on weekly videos. Doing well in your lab course requires students to use slightly different learning approaches compared to classroom learning. Here are a few professor-approved strategies that will help you pass your lab course and ace those practical tests. In many nursing programs, it's expected that students come to lab class already having done the preparatory readings in advance. And there's a reason for this. We're not expecting you to be experts in the topic, but we are expecting you to have some baseline knowledge and understanding of the topic that will be discussed in lab. So for example, if you have a lab that's covering abdominal assessment one week, okay, then you should be doing all of the readings, reviewing the anatomy of the abdomen, reviewing how to correctly inspect, auscultate, palpate, and percuss. You should be able to review the types of special tests that are included in the assessment, what position the client should be in, any assessment equipment that you might need, okay? Basically, you do this homework in advance so that when you arrive to lab, you're not starting from a blank slate and you can really build on the knowledge that was identified in your textbooks. But you want some extra advice? Watch videos as part of your prep work. Nowadays, there's no better way to learn how to do something than by watching someone do it on a video. While you are attending lab, be intentional about observing your instructor. When the instructor is demonstrating something, showing you a technique or a skill, get right up there, okay? Stand right next to them. Stand at the front if you have to. Make sure you can see and hear exactly what's happening. Why? Because your lab instructor is essentially role modeling what is expected of you in the course and how you will be evaluated. Now in the lab, I encourage students to move around, get up out of their seat, get up right close, and even shoulder to shoulder so they can get the full benefit of observing and hearing all the important teaching points. Tip number 3, create watch me moments. Now when I think of watch me moments, I think of my daughters, my 2 daughters, Noelle and Trey, saying, "Mommy, watch this. Mommy, look at me. Mommy, watch." Okay, when then they're trying to do some kind of cartwheel or something. But what I'm suggesting here is for you to create opportunities to receive as much immediate feedback as possible. When you try something out for the first time and you're just learning, the best feedback is when it's immediate. You can make the correction quickly and it's more likely you will remember it. The more you can get your instructor to watch you and evaluate a skill or a technique, the better it is because you get that instantaneous feedback and correction. Now, I know it might be a bit daunting and nerve-wracking to have the instructor watch you because you're afraid of making mistakes or you're afraid of looking silly, but that's what lab is intended for. And besides, isn't it better to make the mistakes in lab versus when you're working with a client? Plus, your instructors, and I've been there myself, we expect you to make mistakes, okay? We'll use your mistakes as a key teaching moment and opportunity for improvement. When you're learning how to do something for the first time, I find that students find it extremely helpful to follow a checklist. Similar to when you're putting something together, right? When you're assembling a new furniture or something. You take the instructions out of the box and you follow them step by step by step. Now, I encourage students to use a checklist if one is available and practice the new skill using a step-by-step approach. Now, many nursing textbooks that you have come with procedural checklists already, so feel free to revert to those resources if you need to review and analyze steps a little bit more closely. Videos can also be helpful for many students, but I've also had many students that prefer to practice a skill by walking through each step until they get more comfortable. Now, some instructors may not use a checklist in the lab, and that's okay. But if you prefer to slowly walk through how to perform a specific skill or a technique, you can actually bring the checklist to the lab and use it to practice or take extra notes. Okay, so it goes without saying, practice equals progress, right? So you've got to practice and practice some more. And typically, lab classes, as you know, are only a couple of hours each week. That is definitely not enough time for students to feel comfortable and confident with a specific skill. So what do? You practice outside of the scheduled lab hours. Practice at home, practice at work, practice with your kids, practice with your partner or your spouse. You might also use scenarios at your clinical placement to practice under the supervision of your clinical instructor, of course. Basically, what I'm saying is you need to create additional opportunities for you to build on what was observed, what was taught and practiced during lab. And remember, as you practice outside of lab hours, if questions come up or you want to clarify something, reach out to your lab instructor and just ask. Or be sure to ask the question the following week when you're in lab. Nursing lab courses are an opportunity for you to apply your nursing knowledge and practice foundational skills in nursing. You can succeed in your lab courses by completing all the preparatory work before attending lab, closely observing your lab instructor, creating watch me moments, using a checklist to practice, and practice, and more practice. I hope you can use some of these strategies as you go through your lab courses. Good luck. Hey guys, thanks for joining me on the JLT channel today. I promise I've got more good content for you, like this video over here. And don't forget to subscribe, hit that like button, hit that notification bell, and even share this video with a friend, because it's just like that.